Okay, so this is the MRI that showing sagittal imaging showing a apparently very large mass involving the entire cella and then extending it to the suprasellar cistern. You can see the small hyper-intense signal right here, and then this may be the residual posterior pituitary. So I'm thinking this is where the normal pituitary tissue is. So you can see the little enhancement, which is different degree of enhancement from the normal, the rest of the tumor. And here's a coronal view. The mass is very, very large and then extending entirely into the suprasellar cistern. And then this is supposed to be the optic chiasm. I'm going to show you the better picture of the optic chiasm with the tumor, but it's very displaced superiorly and flattened. And again, here is a posterior pituitary, probably. And if you give contrast, it enhances homogeneously. And then we are talking about this possible hemorrhage created rapid overgrowth. There are some heterogeneity, and then there is some area of hypoenhancement that may be the necrosis or some hypoperfused areas, but doesn't have any definite area of hemorrhages. Then if you look T2 is again very helpful to see the internal content, including hemorrhages. You can see the fluid level here. So this portion is suggesting there is some internal hemorrhage happening in the tumor. And and then we did, this is all these pictures are from outside MRI, and then we repeated MRI just before the surgery. And then you can see the nice fluid level in the left lateral aspect of the tumor. And then also has some heterogeneity, which may contain some of the hemorrhagic focus. And this is the sequence which you can see the optic chiasm very well. So you see the mass, and then mass and optic chiasm is separately seen. So you can see the degree of deformity and compression of the optic chiasm very well with this specific sequence. This is a cis sequence, which is a very thin 0.8 millimeter thick sequences. Because this is a very thin sequences, you can delineate the small structures like optic chiasm separately from the tumor. And then also this is very sensitive for CSF signal. So everywhere you can see the CSF is well delineated. So you can even see some CSF signal between the tumor and the optic chiasm. Yeah, so here is the Meckel's cave is right here, and then the cavernous ICA is right here, and then you can see the masses laterally extending into the cavernous sinus segment. So these are the preoperative imaging. Yes.
What's the best study or sequence to look at to find the normal gland, the anterior and posterior pituitary gland?
Normal tissue, you can do the pre-contrast. You can carefully look at the pre-contrast T1 weighted imaging. That can show you the residual hyperintensity of the posterior pituitary, as I just showed you. And then one more picture to show you. This is the post-contrast brain lab study. Again, this is a thin cut, 1 millimeter thickness post-contrast studies. This is also helpful to see the normal pituitary is, you can see as a very intense enhancement. So this is right here is the normal pituitary. So that's how you can delineate even the big tumor. Already you can see the normal pituitary has a different, more homogeneous, more intense enhancement compared to the rest of the mass.